In November, I noticed that there was a dimple on my breast, and I thought it was just a sign of old age. My breasts were sagging just like the rest of the body. But then I began to do self-examination on that spot, and it didn't feel the same as the left breast did. So I called my doctor, and they said, please come in immediately. And that's how how my cancer was discovered. And the biopsy confirmed that there was an invasive cancer growth in one of my quadrants of my breast. So I then went for an MRI. The MRI showed that there were other spots in my breast that were suspicious. So I came back for an MRI biopsy. They tested one duct on the bottom of my breast, and it also was diagnosed as cancer. So that meant that there were 4 spots in my breast. Up until that time, I thought I had a decision between a lumpectomy and a mastectomy, but because my cancer was in different quadrants, I needed to have a mastectomy, so I didn't have that choice. Well, when I met with my oncologist, it was very clear that I needed chemotherapy because I am considered a high-risk non-nodal cancer patient. There's a scale here at Dartmouth that they use that ranks your cancer, and I scored highest in risk. My invasive breast cancer was also 2.8 centimeters. And I'm also what they call triple negative for hormonal response on my tumors. There are only about 15%, as I understand it, women with breast cancer that are triple negative. This means that there's no follow-on drugs that they can help hit the cancer with that might be residual. So there was no question that I had to have chemotherapy. At the time I met with Dr. Arrick, I also met with a research nurse called Ellen Parker, and they explained to me a clinical trial that was being run for women with high-risk non-nodal cancer. I immediately, upon learning about the clinical trial, was very interested. So they took a long time and explained what the clinical trial was for, gave me quite a bit of literature to read. I also was able to go on the web when I got home and research this particular trial. And I said yes immediately to being part of the trial. It was that my husband, who recently passed away, had kidney cancer, renal cancer. And most patients with renal cancer live, I think it's about 18 months to 3 years. My husband had 5 years with the cancer. And part of that was because of all the benefits that have been discovered with other drugs that happen to apply to kidney cancer patients. And so he was able to use those drugs even though he did not participate in any clinical trials. So my feeling was the clinical trial gave my husband at least 2 more years, and I felt that they must be good things to be part of. I am very positive on clinical trials, and I feel very lucky that I qualified and that I could say yes to being part of a clinical trial. I don't want to sound altruistic, but because of the experience with my husband, if what I do in this clinical trial that I'm on can help one woman in the future, then I've done a wonderful thing, because I think of all the thousands of women before me that have participated in clinical trials to make my trip through chemo much easier. If it hadn't been for all of those women, I don't know, it might have been a horrible chemo experience. So maybe what I do can help someone have a better chemotherapy, or help the doctor know exactly what treatment to use. This clinical trial is a phase 3 clinical trial. The trial then will determine if the existing standard of care is any better or worse than changing the amounts, the frequency, the dosages, and the timing of the drugs that are given now. After Dr. Arrick and Ellen spoke with me and gave me the booklet that I read from cover to cover, I went on the web and I looked up the Southwest Oncology Group. I actually looked at some of the other clinical trials that they were doing to see what kind of cancer research they were doing. And I looked at this particular study. I saw that it was involved 3,500 women. I saw that it had been in existence for a while. And I also looked at the tremendous number of hospitals that were participating in this study. All that made me feel very positive about the study. Dr. Arrick's been wonderful. He's answered all my questions. He's been willing to talk to me about things that I was concerned about. Ellen Parker is my research nurse, And I cannot tell you what a wonderful, wonderful person she is, and how great it is to have this program of the research nurses, because she's your first line of contact. You don't have to think, who should I call? Will the doctor call me back? I call Ellen for all my little things or my big things, and she helps me with answers or goes and gets the answers for me. I didn't do this trial for myself because I'm getting the same drugs that I would have gotten otherwise. I did this trial because hopefully it will help tailor-make chemotherapy for women in the future. If you're asked to be in a clinical trial, I think you have to look into yourself to see if it's right for you. If you're asked to be in one, that means you qualify for one probably. I think if you look at your own conscience and say, is it right for me? Can I do the protocol that it might take, which might take longer, might take more visits, but is with the standard drugs? I think everyone should seriously consider being in a clinical trial. That's how cancer research advances. When I was first diagnosed with cancer, I realized that I could not choose. I did not choose to have cancer. It chose me. But what I could do was to choose each day how I dealt with it, and how I faced each day, and how I approached all the treatments and surgeries, etc., that I needed to have. And I decided that I was going to be very positive about it, live my life as normally as I could, and I got to choose what my attitude was. Every morning I could wake up and choose what my attitude was. In having that kind of a philosophy, I feel like I gained control again. I could control how I felt. I couldn't control how I felt physically, but I could control how I felt mentally. And I think that was an empowering decision to be able to do that. My husband was my teacher. I saw him go through this, and he didn't want anybody that was down and out around him, and he didn't want people to be sad around him. My husband was a very positive person. He was certainly the glass is half full kind of a guy, and I learned from him. This is my last chemo session. Yay! It's been wonderful. I've had 6 months of chemo and 12 different sessions of it. So I'm very excited today because it's my last one.